this would be for a situation where you can't intubate them standard, or you have an LMA in and you want to be able to intubate through the LMA. The nice thing about this technique is that you can be ventilating and oxygenating the patient while you're doing it. There's only a few steps where you actually have to disconnect from the ventilator, but several of the steps you can do while you're ventilating, so you don't have the issue of the patient starting to desaturate and you having to rush. Okay, so this is called the Cookgas LMA, and this is a special LMA that the cap is removable to allow an endotracheal tube to go through it. I don't know if you were just over here or if you're going to be over there, but what Seth is doing is showing people how to intubate through any LMA that is not specially made for an endotracheal tube. But the two kinds that are specially made are this one, which is called the iGel, and this one, which is called the Cookgas. This mannequin, the 3.5 Cookgas, fits best. So you would basically put this through. And he's a little bit stiff. He's much stiffer than a real patient. But at this point, right, you can hook up and ventilate. Now, and give a few breaths and make sure that your LMA is seated well so that you actually can ventilate. And then what you're going to do is take this cap off, take an endotracheal tube. The 3.5 LMA accepts a 7.0 endotracheal tube. If you use a 4.5 LMA, it will take an 8.0 endotracheal tube. So all you're going to do is take the endotracheal tube. These things are well lubricated already. You want to make sure you have everything lubricated. And you're going to put this down to somewhere between 16 and 18, right at the edge of the LMA. Okay? And then you're going to hook up bronchial adapter, and now you can hook up a ventilator. So once this is here, you can hook a ventilator or an ambu bag or whatever you want to use to ventilate the patient, and you can have an assistant or the ventilator ventilating while you do all the next steps. So that way you can take your time a little bit more. The next step is you're going to take a bronchoscope and go through the bronchoscope adapter. Thank you. It helps to have somebody holding this, and just go all the way down. And if your LMA is seated properly and you were able to ventilate through it, you should get to the end of it and just see your vocal cords sitting right there. This camera's a little bit dark, but so there are the vocal cords right at the end of the LMA, and I'm just going to go through them down into the trachea. I'll go down sort of close to the carina. So at this point, you're going to slide the tube down. So you're going to keep the LMA and the scope where they are, and I'm going to have my assistant, Susan, here, slide that down. And then as I bring the scope out, I'm going to look to see that my tube is in the trachea. So I'm going to come slowly out. And again, I've got this hooked to the ventilator the whole time, right? So I don't have to rush. There's my tube. There's the end of the tube, and that's still in the trachea. So I'm coming out with the scope. And then the last step is getting the LMA out. So the Cookgas comes with these little blue plastic things, but if you didn't have one of these, you could use a 5.0 or 6.02. And at this point, you have to disconnect the adapter that you were using to ventilate. And again, you can use a 5.0 or 6.02. And the goal here is to just hold your endotracheal tube in place while you pull out the LMA. You're not trying to push the endotracheal tube any further. You're just wanting to stabilize it while you pull out the LMA. And then once you've got the LMA out, you can hold it here, pull all that out, have your adapter ready to hook in, and then hook to the ventilator. And then, again, back up to the ventilator, give them some breaths. If you wanted to, at this point, you can go back in with the scope and make sure you're in the right position above the carina. But you also have looked at your tube when you pull it out. So it's a nice rescue technique to get an intubation through an LMA. without having to make them output the whole time. You can be ventilating and oxygenating while you're doing most of the procedure. So, you want to try it?